Okay, here is practice case number 3, and again we're going to gradually increase the difficulty of the cases. So first step is going to be to click on the add setup, or select the upper jaw. Always start with the upper jaw first. Then I always like to start with the central incisors, and then position the central incisors where you want them to go, and then everything else that becomes a foundation for the rest of the case. Okay, so we'll start with the upper left, and this tooth definitely needs to have some advancement. Also needs to have a fair amount of torque. I'm going to go to the upper left central incisor, and that needs to have some torque as well. Okay, and again, really, this, when we're doing the digital setup here, we're not thinking about class 2 correction, we're not thinking about anything else. All the digital setup here is about is creating the nice ideal arch form. Okay, all those other things as far as class 2 correction, that happens with class 2 elastics or anything else that you'd use. So really think about this more along the lines of just using fixed appliances and tying in an arch wire. Okay, all this here is about is getting the nice arch form. Okay, so with that in mind, we're going to now just continue around the rest of the case. So to me, the canine here could use a little bit of rotation, maybe a little bit of advancement, just a little bit of distalization there, and if anything, err on the side of making spaces between the teeth. Okay, teeth always track better when there are spaces between them. So I never feel bad about overcompensating and creating spaces between the teeth, because number one, the teeth will track better throughout the treatment, and at the end it's extremely easy to go do some very targeted space closure with just 1 or 2 aligners. Okay, so if anything, err on the side of making spaces between the teeth, because that just, I think, actually helps with the tracking, because you've got more to surface for the appliance to grab onto. So now we're going to move to the other side, and I'm going to distalize this tooth quite a bit, and so I'm even going to leave a little space. That's a little too far, actually. So I'm going to leave a small space there, you can see. So when I see a small space like that is only going to help us in terms of tracking and getting the desired tooth movement that we want. And again, here I am distalizing this canine, but in reality, that's not what's going to happen. You just need to think about creating the ideal arch form, and not so much about what's going to actually happen in the patient's mouth, because when we distalize the teeth like this, again, that would be no different than placing an open coil spring right here with fixed appliances. Okay, we're going to get a little bit of distalization in the posterior teeth, possibly, mostly some advancement of the anterior teeth. Okay, now these teeth here, I'm going to go ahead and distalize this whole segment here. And we're not looking for perfection here. This is just our first. The whole purpose of this case setup here is get us to a point where it's easy to refine it. Okay, so just don't worry about getting the case perfect, because we just want to get us close to the finish line, and then we'll come back. The whole goal of this is going to be to just get us to a point where it's easy to refine and finish the case. Okay, so don't put pressure on yourself to make it perfect. So now we're going to wrap around to the facial, see if there's any sort of tip or torque that needs to be done. Okay, that looks good to me. So we're going to click on OK. And now the software is calculating the tooth movements as well as morphing the gingiva. Okay, that is done. And now we're going to move on to lower teeth. You can see here, lower teeth are fairly crowded. And again, what we're going to do now is we are going to click on Add Setup, lower jaw, click on OK, and then we're going to click on the staging tool, the central incisor, and then we're going to move that central incisor up to ideal, where we want that to end up relative to the upper central incisors. Now I'm going to turn off the upper, and then we're going to look at these lower and central incisors, and again, this is going to be the foundation by which the whole lower arch is going to be set up. So I'm going to put in the right tip and torque here. And this is something interesting to point out. Now you see here, this in the software we fill in, so we create a little bit of convexity there to help I guess compensate for any tooth structure that is just simply missed in the scan. Okay, but what I'm pointing out here is that ultimately on a case like this, again, it's just so important to keep in mind that all we're doing is just trying to get the case close enough where it's easy for us to finish it with refinement. Okay, so don't even be thinking about refinement at this point and getting exact tooth positions. This is just about getting us to a point where it's easy to rescan the patient and refine the case. Okay. So I'm going to take all these teeth out like this, and I'll show you a little trick here at the end that can help build in a little bit of extra movement for us, or a little bit of extra arch development for us. And then I'm going to take this whole segment here by holding down the control key, and I'm going to distalize that segment. And then this segment here I'm going to distalize just a little bit. And then these anterior teeth to me look like they could use quite a bit of torque. Just make sure that, because the gyroscope is active, so you don't want to click on the gyroscope because that will move the teeth too. So when you're selecting tooth, just be careful to click on the tooth and not the gyroscope. So I'm going to add a little bit of torque to these teeth here. And then I'm going to wrap around the facial one more time. You can see here that we really should do some, do we want to intrude or extrude those teeth? Because he's got quite a bit of wear on those. So I'm going to actually extrude these teeth here just for the demonstration purposes. And then let's do just a little bit of fine tuning here. Okay. Now, what I'm going to do here is just build in a little bit of a buffer zone, a little bit of extra tooth movement. We're not going to get this clinically, but it just helps sort of enhance the tooth movement. And that's going to be to just build in some overall expansion. Okay. And the way we do that is we're going to click on and I'm going to do it from first molar to first molar. Hold down the control key, and I'm going to go all the way around the arch here, every single tooth. And I'm just going to expand these out facially. And then I'm going to come back in now and maybe just even these teeth out a little bit. In particular, lower central incisors, because that's really where all the crowding is. And then now we're going to click on OK. So now we're not going to get that tooth movement. That is to build in some overcompensation as we are progressing through the patient's treatment. Okay, so all that's going to do is just give us some arch development and tip the odds in our favor of getting us to a point that's going to be very, very easy to finish the case. Now, so here we are after the gums have morphed, and we are at the quote-unquote ideal tooth positions. Okay, so we built in some spaces in between the teeth. Now, what does that mean? Okay, so what that means is I'm going to look at the tooth movement chart over here. Let me close the upper so we can focus on just the lower. And I'm still going to follow my guidelines, okay? So, and my guidelines would say that, you know, our largest rotation is probably, or our largest tooth movement, we've got 3.75 millimeters of that lower central incisor. We've got quite a bit of tipping here. We've got a lot of rotation of, so that lower left central incisor is really the limiting tooth. So I don't want to move this tooth any faster than 2 degrees per setup, okay? And that is going to give us, so 2 degrees per setup is going to give us roughly 13, and I don't want to move any faster than 0.3 millimeters per setup, and even that's pushing it, especially when we've got a very, very small tooth like that central incisor. So I'm going to actually fudge on the side of going a little bit slower, okay? And so I'm going to put in, instead of 13, I'm going to go ahead and put in 16. And then click on OK. And again, depending on the speed of your computer, but it would probably take roughly, on my computer, I'm going to pause it here, but this takes probably about 3 to 4 minutes for the software to crunch, you know, to do all the calculations here. Okay, so here we are now after the software has created the 16 separate intervals, and we're going to go back to setup 0 here and just click through the intervals here. And what I would do is I just like to look at the case and then just, you know, make chart notes so that when the patient comes in, I'm going to really monitor specific contacts closely, okay? In particular, this contact right here, and actually probably all the anterior contacts. So and what I mean by that is each time the patient comes in, I'm just going to do the simple floss test, run the floss between the contacts. If there's any contacts where the floss binds, I'm just going to take 10 seconds with an IPR strip and just a little bit of IPR between those teeth there, okay? And that's just going to reduce the chances of any extra collisions happening. All right, now, next question is how many, on this case here, it's very unlikely that I'm going to get to the 16th aligner, okay? More than likely, I'm going to be rescanning this case just because I like to rescan maybe every, I'd say between 10, at least on this case, I probably rescan at around, you know, aligner number 12 or so, 12 or 13. It just depends on what the clinical signs or the clinical conditions are telling me. So if I am starting to see the aligners not tracking very well, on this case here, my crystal ball tells me it's going to be probably between 10 and 14. All right, but we built these spaces in so that we have sort of a margin of safety as the patient is progressing through treatment, because again, I love spaces. It really helps those teeth track well. More than likely at around between, I would say, 10 to 14 or 15 or so, I'm going to be rescanning the patient, and at that point is when we're going to really look at finishing and getting those perfect tooth movements or the final tooth positions honed in. So hopefully that makes sense, and look forward to seeing you in the next video.